Artificial Intelligence Dr. www.abcpharma.net/English. How does the lack of atrial pacing affect the long-term clinical outcomes and quality of life in patients with an Aveir VR leadless pacemaker compared to those with dual-chamber pacing systems? Claude AI. The lack of atrial pacing in patients with an Aveir VR leadless pacemaker can have significant effects on long-term clinical outcomes and quality of life compared to those with dual-chamber pacing systems. Here's a detailed explanation. Cardiac function and hemodynamics. Dual-chamber pacing maintains atrioventricular (AV) synchrony, allowing the atria to contract before the ventricles, which enhances cardiac output and hemodynamic performance. In contrast, single-chamber ventricular pacing without atrial synchrony, as in the case of the Aveir VR leadless pacemaker, can lead to suboptimal cardiac function and reduced cardiac output. This can result in symptoms such as fatigue, dyspnea, and reduced exercise tolerance, which may negatively impact the patient's quality of life. Pacemaker syndrome. Patients with single-chamber ventricular pacing are at higher risk of developing pacemaker syndrome, characterized by symptoms such as neck pulsations, dizziness, and syncope. Pacemaker syndrome occurs due to the loss of AV synchrony and can significantly impair the patient's well-being and daily activities. Dual-chamber pacing systems, which maintain AV synchrony, have a lower incidence of pacemaker syndrome and generally provide better symptom relief. Atrial fibrillation. The absence of atrial pacing in patients with an Aveir VR leadless pacemaker may increase the risk of developing atrial fibrillation over time. Atrial fibrillation is associated with an increased risk of stroke, heart failure, and reduced quality of life. Dual-chamber pacing systems, especially those with atrial pacing and algorithms to prevent atrial fibrillation, may help reduce this risk and improve long-term outcomes. Pacing-induced cardiomyopathy. Long-term single-chamber ventricular pacing without atrial synchrony can lead to the development of pacing-induced cardiomyopathy, characterized by left ventricular dysfunction and heart failure symptoms. Pacing-induced cardiomyopathy can significantly impact the patient's functional status, quality of life, and overall prognosis. Dual-chamber pacing systems that maintain AV synchrony and minimize ventricular pacing can help reduce the risk of pacing-induced cardiomyopathy. Patients with single-chamber ventricular pacing may experience reduced exercise capacity and difficulty performing daily activities due to suboptimal cardiac function and hemodynamics. Dual-chamber pacing systems that provide atrial pacing and maintain AV synchrony can help improve exercise tolerance and overall functional status, leading to a better quality of life. Some studies have suggested that single-chamber ventricular pacing without atrial synchrony may be associated with increased long-term mortality and morbidity compared to dual-chamber pacing. However, more research is needed to fully understand the long-term impact of the absence of atrial pacing in patients with leadless pacemakers like the Aveir VR. It's important to note that the decision to implant an Aveir VR leadless pacemaker is based on a careful assessment of the patient's individual needs, comorbidities, and risk factors. While the lack of atrial pacing may have potential drawbacks, the benefits of a leadless pacing system, such as reduced lead-related complications and improved patient comfort, should also be considered. Regular follow-up and monitoring are crucial to assess the patient's clinical response, quality of life, and the need for potential upgrades to a dual-chamber pacing system if indicated. GPT-4o. The lack of atrial pacing in patients with an Aveir VR leadless pacemaker can have significant effects on long-term clinical outcomes and quality of life compared to those with dual-chamber pacing systems. 1. Atrial contribution to cardiac output. In dual-chamber pacing systems, atrial pacing ensures atrioventricular (AV) synchrony, which is crucial for optimal cardiac output. 1. Without atrial pacing, the loss of atrial contribution can lead to a reduction in cardiac efficiency, especially in patients who rely on atrial contraction for adequate ventricular filling, e.g., patients with diastolic dysfunction. 1. Atrial fibrillation (AF). The lack of atrial pacing may predispose patients to the development or worsening of atrial fibrillation, as atrial pacing can help prevent the onset of AF by maintaining a regular atrial rhythm. 1. Exercise tolerance and fatigue. Patients without atrial pacing may experience reduced exercise tolerance and increased fatigue due to suboptimal heart rate response to physical activity. 1. Dual-chamber systems can adapt to physiological demands more effectively by ensuring both atrial and ventricular pacing. 1. Heart failure risk. The lack of AV synchrony in patients without atrial pacing can contribute to the progression of heart failure. 1. Proper AV synchrony helps maintain efficient ventricular filling and ejection, which is particularly important in patients with heart failure or reduced ejection fraction. 1. Daily activities. Patients with only ventricular pacing may experience more symptoms like dizziness, palpitations, and decreased exercise capacity, which can negatively affect their quality of life. 1. Dual-chamber pacing can provide a more physiologic heart rate response, improving overall well-being and daily functioning. 1. Mortality and morbidity. Studies have shown that dual-chamber pacing is associated with better long-term outcomes in terms of mortality and morbidity compared to single-chamber ventricular pacing, particularly in patients with sick sinus syndrome or AV block. 1. Device longevity and complications. While leadless pacemakers like Aveir VR have the advantage of fewer lead-related complications, e.g., lead fractures or infections, they may not provide the comprehensive pacing support needed for certain patients. 1. Dual-chamber devices, though more complex, can offer more complete rhythm management. 1. Advantages of Aveir VR leadless pacemaker. 1. Reduced risk of lead-related complications. 2. Minimally invasive implantation procedure. 3. Suitable for patients who do not require atrial pacing. 1. Advantages of dual-chamber pacing systems. 1. Better hemodynamic performance due to maintained AV synchrony. 2. Lower risk of atrial fibrillation. 3. Improved exercise capacity and quality of life. 4. Better long-term outcomes in specific patient populations. Patients with an Aveir VR leadless pacemaker may experience adequate pacing support if they do not require atrial pacing. However, for those who benefit from AV synchrony and atrial pacing, dual-chamber systems generally offer superior clinical outcomes and quality of life.